next time you feel your anger boiling up, you might want to take a deep breath. New study by the American Heart Association says it could negatively impact your blood vessels and your health. Joining us to talk about that and other health headlines today, he is Dr. Bill Hartman, clinical trialist at UW Health. Doctor, it's so great to see you. And it turns out anger really does course through our veins, and it's not good for us.
Right, and this is something that's been suspected for a long time, that emotions can have an effect on your health. And in this particular study out of Columbia that was published in the Journal of the American Heart Association this week, they actually showed for the first time that anger is associated with worsening of your vascular health. They compared it to feeling anxious or feeling sad, which really didn't have any effect on people's vasculature at all. But anger truly did. And for 40 minutes after the person's angry episode, those conditions persisted. And so the take-home message here really isn't that you should never get angry, but really try to minimize and control your anger as much as possible, because in the long term, it's going to have much greater benefits to your health.
I found it really interesting that sadness and anxiety didn't have a similar effect. Why? What's going on?
Well, it's hard to say, and we don't know exactly why. I don't know that we know anything more than, did the markers of inflammation, did the markers of vascular health go up or down? They just didn't change when people felt sad or anxious, the same way that they did when people became angry. And so really the emotion that you have to keep in check is being angry. And
there's a lot of people who struggle with their anger. I mean, like, the little things can set them off. But the good news, I mean, some people just, they're like, I'm just angry. Well, no, that there are proven therapies out there, right?
Right. And those types of therapies, both medical or psychological, depending on how you want to treat your anger. If you feel you're a person who is prone to getting angry quite easily, there are treatments out there that will not only improve your mental health in Mental Health Awareness Month. That's something that we should all be aware of, but also is going to improve your long-term cardiovascular health and make you healthier in the long run.
In my house, we say, if you're feeling mad and you want to roar, take a deep breath and count to 4. Daniel Tiger taught us that. I can tell you it has very little effect on 3-year-olds, but we're trying. Hey,
excellent.
If we needed another reason to believe science is awesome, tell us about this experimental gene therapy that's restoring vision to blind patients.
Right, so this is really a groundbreaking proof of concept. And what they are doing is they took 14 patients who have a rare genetic form of blindness that causes problems with their retinas. And in each of these 14 patients, they corrected the gene using CRISPR technology and injected the medicine that had that corrected gene into the retina of a single eye. And after about 3 months, in 11 of these 14 patients, they saw a significant improvement in the vision in the eye that had been treated. And so this is not a cure. It still has a ways to go, still has to be repeated in a much larger study. But really, it's the first time we've seen an effect like this, treating a genetic disease with CRISPR technology, having this kind of a beneficial effect.
It's so awesome. There's so much promising things happening out there in the science and medical world. We never get mad talking to you, Dr. Bill Hartman from UW Health. Appreciate your time.
Thank you.